Every practice owner knows the sound of the front desk losing the battle. A receptionist is in the middle of a patient chart, the phone rings, they get pulled away, and the cycle repeats. On average, a medical receptionist fields 80 to 120 phone interactions a day. That is a staggering volume of interruptions, stacked directly on top of greeting walk-ins, verifying insurance, and managing the waiting room. The human toll of this workload is measurable. Nearly 46% of healthcare administrative staff report symptoms of burnout, and medical groups are now seeing a 40% annual turnover rate for front office support. Every time someone leaves, years of institutional knowledge walks out the door with them. Adding another person to the phone lines does not fix this. If the call volume continuously exceeds human capacity, hiring is a temporary patch on a structural failure. This graph illustrates exactly why the phones are winning. Between 2019 and 2024, call volume to medical practices increased 45%. During that exact same period, available staffing levels dropped roughly 12%. Looking at the composition of those calls, an estimated 70% of them are routine. Patients are calling to confirm appointments, ask for directions, check office hours, or request prescription refills. Asking a highly trained patient coordinator to manually answer dozens of basic, repetitive questions every morning consumes hours of valuable human time that should be spent on complex patient care. A standard front desk team cannot outwork this math. Keeping up with modern call volumes requires intelligent automation to handle the routine load. Early attempts at healthcare automation failed to solve this. Traditional phone trees asking patients to press 1 for appointments and 2 for billing reliably caused so much frustration that staff ended up intercepting the calls anyway. Modern AI voice technology works differently because it relies on natural language processing. Instead of forcing a caller through a rigid menu, the AI listens and understands conversational context. If a patient calls and says they need to come in sometime next week for a follow-up, the AI interprets that scheduling request, independently checks real-time calendar availability, and books the correct appointment. For this to actually save time, the AI must integrate directly with your existing electronic health record system from day one. It has to read and write to your scheduling software to prevent staff from having to manually reconcile bookings later. That capability extends into the night. A voice bot that can handle calls and schedule appointments 24 hours a day captures revenue from patients who reach out after hours and might otherwise never call back. The system does not deflect callers or put them on hold. It fully resolves their requests, allowing the human staff to focus exclusively on the patients standing right in front of them. Managing the phones is only half the operational challenge. Most medical practices suffer from data blindness. They process thousands of calls per week without any visibility into hold times, abandonment rates, or patient complaints. An AI voice system acts as a continuous intelligence gathering tool. It processes every call transcription, filtering chaotic audio into neat categories. Weekly, this data populates a structured analytics dashboard, giving leaders actionable reporting on key performance indicators like call volumes and resolution rates. Identifying these specific operational bottlenecks would take a human analyst hours of tedious manual review to replicate. The AI does it continuously in the background. Armed with clear weekly analytics, practice managers can make evidence-based workflow decisions. The phone system turns from a source of daily anxiety into a fully transparent operational asset. Building this level of capability in-house is financially out of reach for most medical groups. You would need to hire dedicated IT support, purchase compliance tooling, and recruit specialized data analysts alongside your call staff. This chart highlights the financial advantage of an outsourced AI model. By partnering with a provider like Staffingly, the AI starts at $8 per hour per full-time equivalent. That delivers up to a 70% cost reduction compared to managing in-house infrastructure. All the mandatory regulatory requirements are built natively into the service. The system comes equipped with HIPAA compliance, SOC 2 Type 2 certification, and encrypted VPN access standard from day one. Implementing integrated AI voice and analytics is an operational upgrade that actively protects and expands practice margins. Across the industry, 63% of U.S. healthcare organizations are already piloting or deploying AI voice technologies. They are building compounding operational advantages right now. This is exactly what prompted one practice administrator to leave a 5-star review for Staffingly, praising two things: the seamless integration and the excellent analytics. That transition from front desk chaos to a fully integrated live AI system can be completed in just 48 to 72 hours. It is time to stop making staffing decisions blind. Start your risk-free pilot with Staffingly today and reclaim your front desk.